So, with this, we can come up to the wall, stand in front of the wall. You need to do push-ups on the wall for me. This way, stop. Nice and slow when I tell you. See how much faster it's doing?
Jeez.
Stop. Go down.
You're on 20 hertz right now.
Yeah, try again.
Jeez.
Looks like the scapula's firing more too as well, isn't it?
Okay.
So could you do a similar kind of thing with like vague patellofemoral pain, get them to do like squats as you...
Yeah.
Yep. Jumper's neat.
Squat without and then squat after.
Or even during, or... Yeah.
Yeah, squat during, yes.
Because when we're close chain,
Gel.
you get, so that's what happens. Worse is when they're like business people and they put their shirt on and it's like, oh.
There you go.
Yeah, it's like, that's not going to be good for work today. Yeah, so what we're doing there, we're loading and we're moving dynamically. Okay, way more things happening.
Yeah,
everywhere. Neurological, biomechanical, you know, physiological. All these things are in play. All the logicals.
Yeah, wait. What is that? Because you're lifting up.
Yeah, so if he did it with it's all whole.
Okay.
Just
so these are things you can try with patients. So sometimes patients, they'll come in and they'll go, that's fine, that's fine, that's fine, that's fine. And you'll go, oh, your shoulder works fine. And they go, no, my shoulder hurts when I do push-ups. Let's do some push-ups.
Wow.
See.
Who needs a massage?
Right? So sometimes people only get their pain when they do a certain activity.
Yeah.
That's right. Right? So why not treat them while they're doing that activity? Yeah? Tennis player only hurts when I'm like this with my tennis racket. Okay, bring your tennis racket in.
Is that part of this?
Now I can do it. Because they might be able, you might check them.
Yeah, they can get full range and everything.
And yeah, they go, oh, good range. You know, good range. You do the muscle testing. It's all good. Only hurts when I do this. Let's do that. Yeah, you got to think outside the box.
Is that part of that 4?
That's that 4. Yeah. Yeah. So it's on here. So the ironing we showed you, the passive, so that's where I can grab it and just move it like I was doing with the ankle. This is passively dorsiflexing. We can do active, where he's moving it actively. Resisted, so I can that's essentially resisted. He's got that, or you get like a TheraBand and you get them, you know, to pull it. Yeah, while you're doing it. Assisted. So that's more if they're struggling. So say they're really weak and she can't or he can't lift his shoulder to here. I help him. Yeah. So say he just had surgery, or he's just had a tear, or he's in a lot of pain because of his acute injury. I'm helping him. But it's also, again, it's moving. It has different physiological effects than just having it in neutral and keeping it there. Okay? Because he might only get pain at this angle. Right? Why wouldn't I work? Why am I going to work here? Yeah, he only gets pain here. That's where I want to work. That's the sticking point. Yeah? Dynamic, so that was dynamic, what we did there. You can even do like really advanced, you get like Olympians and stuff. You get them on a wobble board. Awesome. Awesome stuff. But that's next level. That's, you know, if I'm working on an Olympian, it's because she's one of the best in the world at what she does. Loaded, so I can get them. Then this is a 10-kilo weight. Yeah. He's got a bicep problem. Can do some arm curls. Yeah. Again, it's working it differently. Yeah. So look at all the different ways we've got to work in. A lot. So don't just go the standard tuck, 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 in a neutral position. Yeah? Have a play. It's all right if you get the result this way. It's when you don't get the result. Yeah. Okay? You got to change it up. Okay? Nerve tension wrist I showed you. Okay? So that was the side. You can do it anywhere. Say good one, you know, and you do the perineal down here, superficial perineal, deep perineal, get them dorsiplantar, get in there. Median nerve's awesome. Get in there. Ulnar nerve, all that stuff. You'd be surprised how many people have nerve entrapment. People think, you know, I gotta have neurological symptoms. He didn't have neurological symptoms other than a terrible SLR. Right? But based on that, I found that he had nerve entrapment. Because he did. Alright. So this is just going on about the ironing. You guys will get these notes. So these are just all the benefits and stuff. Okay.
What was your question, Sally? You had a question?
Yeah. In terms of, I guess, timeline for the injury, like you've got a football player who's just ruptured a tendon.
Yeah.
Are you going to use that then, or is it only for chronic injuries?
Are you talking about a full rupture with the tendons in two pieces? Or
No, say high grade, grade 2
piece,
tear or something like that.
Yeah, so what's your question?
So when the injury's in the acute phase, is it appropriate to treat with a shockwave therapy?
I do.
There's a lot of that coming out. Actually, I was just in Japan for an osteo conference, and Alison Lin, who used to be one of the teachers at the Sydney Uni program, who's got a unit, someone ran into her on the last run of the last day, as you know, as usually goes, and we're heading back for the afternoon session, and she shockwaved herself right away because her feeling is that, okay, well, she knew she had a tear to the tendon. She wanted to get blood flow to the area, and she sent me a few messages with, in practitioner speak, that it definitely played a part in helping rather than the adverse of icing. She goes, I want to put, and the whole thing is going away a bit from the icing. Like the ice bath is more about, using blood flow to help an area.